Welcome to UPLEVEL, Real Health, Real Talk with Dr. Jenna Blasi. I'm Dr. Jenna. I spent years crafting ways to help women thrive, and I want to help you do the same. On this podcast, we dive deep into health at every level, focusing on the mind, the body, and the spirit. This is where real conversations meet transformational wellness. We'll be talking about all the things that truly matter, from nutrition and fitness to lifestyle, mindset, and personal development. Plus, the real deal on managing stress and navigating menopause. So if you're ready to elevate your health journey with authentic, transformative insights, you're in the right place. Let's get started. Hello, and welcome back to UPLEVEL. I'm Dr. Jenna, and today we're going to continue our theme of heart health and bring it together with stress and the nervous system and how it affects the heart. So earlier this month, we talked about self-love and heart health and how emotional safety matters. We got into cholesterol and some of the other factors. Today, we're going to go deeper into the mechanism of what stress physically does to the heart, even when you think you're coping. Because stress matters in terms of the heart health, even if your labs look okay. And looking at what is happening in my body under chronic stress, even if I'm not emotionally distressed. Some of you are very aware of the stress, and maybe it's not showing up on your labs yet. Maybe it is. We do a little deeper dive, with the people that we work with at looking at the labs. But even if the labs are relatively okay, what's really going on? And then what about if you feel like you're relatively okay, but you're still under chronic stress? Typically, when we talk about heart health, we focus on labs, food, exercise. But one of the most powerful drivers of cardiovascular risk in women isn't discussed clear enough, in my opinion, and that is chronic stress and how it impacts your nervous system. Now, I'm going to say up front, this isn't about being calmer. Sure, that plays in. This isn't about mindset hacks. Sure, that plays in. This is about actual biology. Resistance isn't laziness. It's protection. All right, from a mindset standpoint, resistance is kind of a different thing, but there's really listening and tuning in. If your body is resisting change, if you're doing all the things, what's really going on? And the resistance we feel to actually like optimal functioning sometimes to doing what needs to be done, that's your body protecting itself. Okay, so we're going to look at the role of the nervous system in health changes, why bodies resist fat loss, change, and intensity under stress. I talked about that a little bit earlier this month. Safety versus willpower, and how regulation actually creates capacity to get results. And I really want to reiterate things I've said before. Forcing will backfire long term, and force negates. But especially when it comes to our health, that forcing will backfire long term, because when we have got chronic stress, feeds into insulin resistance, feeds into increased visceral fat, feeds into more inflammation, and then it's a vicious cycle. More inflammation, harder to get the results, more stress eating. So this is why doing all the right things can still fail under load. And there are so many pieces that go into weight in particular is one of the things that a lot of people are working with. There are so many factors. It's not just cortisol. It's not just hormones. It's not just your home environment. Like it's so many things. And when we talk about, as I frequently do, high achieving women, caretaking, mental load, fragmented sleep, burnout, what do we get from that, right? Burnout, overfunctioning, cardiovascular risk, like straight up cardiovascular risk. And this is why this matters more than like the next supplement that you are looking to take. Regulation of your stress, regulation of your nervous system is not optional for your heart health. And it's not optional in this time of life either, because our risk of cardiovascular disease increases so dramatically. So we can't out-exercise or out-eat a dysregulated nervous system. All right. So as we go through this, you can think about like what's one signal your body's been sending, and what's one way you can respond rather than override. There's two main types of stress: acute stress and chronic stress. So acute stress is adaptive. It's short term. Exercise is an acute stress. Chronic stress is unresolved and ongoing. There's an ongoing stress on the system. There's an ongoing load on the system. So caretaking, emotional labor, high responsibility without recovery, overwork, no boundaries, holding it together for years, being the one worried about everybody else and making sure everybody else is getting taken care of. Your body doesn't differentiate between emotional stress and physical stress. It just experiences demand. If we have a phone that's malfunctioning and we're freaking out about it, the nervous system, the adrenals don't register that different as like a threat to our survival. And so it's similar, if we look at the mindset work, the way the subconscious doesn't know. I'm not sure if it's similar. I'm just having this thought. So maybe I'm going to say it and decide it's not similar, but I'm thinking the subconscious can't distinguish between past and present. It only knows future, which is why I am statements are so important. And it can't distinguish. This does link. It can't distinguish between what's real and what's imaginary, which is why we want to use our imagination for us, not against us. Most of us go to a worst case scenario, use our imagination to replay bad things that have happened or bad things that could happen. That's using it against us versus using it to create the life you want, because it plants into the subconscious, which doesn't know reality from non-reality, from imagination, which is why you can think about getting on stage, or you can think about something bad happen and feel a visceral response, feel yourself physically responding as if it has already happened. So it's the same, the emotional stress and the physical stress on the nervous system. It just experiences demand, doesn't know if you're fighting for your life or if you're having computer problems. So when we look at chronic stress and what it does physiologically, you have sustained sympathetic activation. So sympathetic is our fight or flight. So we're not digesting, we're not resting, we're not recovering. We have a disrupted cortisol rhythm, reduced heart rate variability, increased inflammation. I have a whole episode on inflammation and the issues that inflammation causes in the body. You have higher blood pressure over time, and this takes effect on glucose and lipid metabolism. So over time, this stress physiology contributes to vascular strain, metabolic dysfunction, and increased cardiovascular risk. And the reason it hits women harder in midlife is because estrogen previously buffered the stress response. And after menopause, therefore, we have less resilience, we have slower recovery, and we have a higher stress sensitivity. This isn't you failing. This isn't you not handling stress the same because there's something wrong with you or you're not strong enough. The same stress load that was manageable in your 40s may feel very different in your 50s and 60s. Not because you're weaker, but because your physiology has changed. Now, I know that a lot of the people listening are in the menopausal years. I don't know how many male listeners we have, but this stuff matters for you as well and the women in your life. But I want to speak out to the younger women who listen, or go grab the younger women in your life. It's important to get on this stuff before it's an issue. Let's not wait until the way that we handle it and our physiology changes to address stress and eating and exercise and lifestyle and hormone balance in our 50s. Let's go upstream. Let's start understanding how chronic stress takes its toll over time. And if you're in your 30s or earlier or early 40s or wherever, let's start addressing these things now. But fast forward to those of you that are in the midst of this. This is why doing everything quote unquote right can still fail. A healthy diet and exercise, they're not going to do the trick if the stress load is high. You won't get the same results. If you're overtraining and under recovering, if you've got perfectionism as a stressor, and this can also lead to labs. Labs can sometimes worsen despite effort, right? So it's you're doing everything right, but your cholesterol is still increasing, or the labs are worsening, the inflammation is showing. Because if the system never gets a break, if the system never stops, if the system never stands down, that hypervigilance, it will eventually push back. And this is what I see so often in midlife, which is why I also want to speak to younger people. What we can get away with, quote unquote, get away with earlier in life catches up to us in midlife. The body is like, no, I don't have the reserves. I don't have the resilience. I don't even have the hormones to manage this anymore. But that doesn't mean we wait until that happens. Those habits will catch up. And even if you have really good habits, we start having problems. So recovery is a health behavior, and it should start always, ideally. So if we look at, what actually helps, and I talked a lot about consistency in January, recovery is a health behavior, and consistency matters more than intensity. And your body might be telling you to be less intense. So just be consistent. And sleep and circadian rhythm are cardiovascular inputs. So your sleep's disrupted, your circadian rhythm is all over the place. This is affecting your heart. And emotional stress counts. Emotional stress counts. It's not just in your head. It counts. And so supporting heart health is not just about adding good habits. Yes, if you don't have good habits, add those good habits in, but it's also about removing chronic pressure from the system. When I talked about growth and personal growth and identity in January, I talked a bit about what do you need to let go of, not what do you need to add on. What do you need to let go of? An old belief, an old behavior, an identity. When we're looking at heart health, we want to remove chronic pressure from the system. Think of a pressure cooker. Right? The pressure is just building and building and building. You got to release that pressure before you can even get to what's inside the pressure cooker. So looking at your heart health, we do want to dial in healthy habits. We do want to address your cholesterol and those other pieces I talked about in the last episode. We want to remove chronic pressure from your system. I remember when I was in my early 40s and I was having some fertility issues, which, you could say is expected because I was over 40. But I really was convinced I had young eggs. I was healthy and I, kept my body healthy and my habits were healthy. And I just thought I had 20-year-old eggs. And then I actually finally went and got a workup. And not only did I not have 20-year-old eggs, I was told I had eggs that were older than I was. I think I was 40 or 41, maybe when I did the first actual workup with a fertility specialist. And he said, you have the eggs of a 44 or 45-year-old. I was like, what? It's very humbling. But anyway, I think I mentioned this. In a previous episode. So for those of you that have heard it before, but my dear friend and colleague, Leslie Vogel, she said to me, even though you handle stress beautifully, it's still stress. So I know some of us are used to just functioning at a go, go, go level, and you might handle stress really well. Just because you handle it well, just because your labs don't show it, just because you don't feel emotionally distressed, doesn't mean it's not having an impact on you and your system and your long-term health and your longevity. And we don't want to have those days or that future where, I've seen people, it's like they're going along, and they're great. And then it's like they wake up one day and their skin is not as nice, or they wake up one day and they feel like they're bloated and puffy. Like it can be so fast where you go, what happened? And it can be gradual where you look back and go, what? This isn't the person I was 6 months or a year ago. But I want to stress, this is not a personal failure. The good news is the nervous system is trainable, and small reductions in load matter over time. Small reductions in load matter over time. So sometimes you don't do the big things because you're already in threat mode. You just calm everything down. So health, particularly heart health, really isn't just about what you do. It's also about what your body is carrying. Think of it of you're strong, you're healthy, you're going on a hike, right? You're going on the hike. You need a strong heart to go on the hike, but you're carrying an extra load. Your heart rate's going to get up faster, right? You're going to be out of breath quicker. Let's say you've hiked this one mountain 100 times. You're like, I got this. And your breathing is actually pretty good. And then you put on a backpack with 20 pounds. No, maybe you'll feel it, maybe you won't. Backpack with 50 pounds. You might start breathing a little heavier. 70 pounds, 100 pounds. Your heart health is in direct proportion as well to what load you're carrying. I remember when I would hike with my son when he was 7 months and I had the baby carrier. I remember it more with my son than with my daughter, although I hiked with both of them. Just feeling like, oh my gosh, I was really getting, an extra workout and could feel it in all my muscles. So remember, not just what you do, but the load that you're carrying. Okay. So I'm going to close this. I try to keep some of these episodes shorter because I don't want them to add stress. I want you to be able to listen to them during your commute or when you're getting ready. Keep them a little shorter and sweeter when I don't go off on tangents for longer. Understanding stress physiology gives us a different lens, not to fix ourselves, but to work with our biology instead of against it. All right. So understanding, you're just changing your perspective, giving yourself a different lens. It's not about fixing yourself. You're not broken, but let's work with our biology instead of against it. Okay. Now I know this episode was on heart health and there's a lot of talk on hormone therapy and heart health. And so I just want to add something unplanned in here that, I always typically add something unplanned, but this is like off topic, unplanned. I had a interview with a potential patient program member recently who was telling me that her doctor told her she couldn't take hormones while she was still in perimenopause. Just when I think we're making progress, I hear these stories of people being told they can't be on hormone therapy because there's a family history of breast cancer, or they can't be put on hormone therapy because they're perimenopausal. Protecting this stress response, protecting our bones, protecting our longevity, protecting our sanity and our quality of life, that starts before menopause. All right. If you're postmenopausal, that's great. Get on it. Like better late than never. It starts before. And so if you have a practitioner telling you, or if you are a practitioner telling people that we have to wait. They said, we have to wait till you've gone. That's what they told her. We have to wait 1 year till you've gone 1 year without a period before we can address this. What? No, at least with hormones. It's not true. It's not true. And it's such a disservice. All right. Just like it's not 100% true. If you're over 60, you can't start hormone therapy. There's a window of opportunity. There's an ideal window. So that part's not true on the latter end, but on the earlier end, that window of opportunity is about like the safest in terms of waiting too long. It doesn't mean you can't start in perimenopause. And it is actually a game changer for many women who start hormone support in perimenopause. And I know it can seem counterintuitive because you still have your various hormones. But if you're not sleeping, if you're not managing stress, if everything is kind of spiraling, your brain fog, you're getting hurt more often, you're not recovering, et cetera, that hormone support is going to make all the difference. Now, there's various ways to do that, but I just want to be clear that hormone therapy is absolutely a tool that you do not have to wait until you were technically menopausal, which is what 1 year without your period is. She was told you have to go 1 year without your period, so she's officially menopausal, because that menopause is the day. Menopause is 1 day. It is the day you've gone 1 year without your period. So for anyone, even if men listening, if you have, women in your life are suffering, let's stop white knuckling it. Let's stop suffering through, because that is stress. That is going to impact the heart in a not so great way. So that's where I'm tying that piece. And as always, thank you all so much. If you found this impactful, please share it with a friend. Please subscribe and follow us so that we can reach more people, so that you don't miss an episode. And, I often give tips at the end. I gave it at the beginning this time. Just look at where are you maybe pushing? Where are you forcing? And where can you, let go and maybe just shift listening to a signal. But I would also say, where can you look at not just one way you'll respond instead of override, but where are you just not dealing with this stress? It could just be simplifying. I used to, work a few different places. Even as a doctor, I had my private practice, and then I was out at Miamo Enchantment Resort doing consultations out there. Then I was teaching fitness classes, and I was always kind of running from place to place, and I loved it. It was really fulfilling until it wasn't, until it was too much, until it was more stress. So when you start to feel that in your system, you're like, you know what? I'm feeling tension around this. then where can you simplify? And that's when I started peeling back and said, here's where I want to focus, because I know it's better for my stress. And ultimately then, we're serving at a higher level when we put those boundaries up and take care of ourselves and prioritize our health. So thank you so much. We'll see you next week while we tie all of the heart health together. And then stay tuned. I'm going to dive into GLPs here in March as well. So thanks so much. Take care, and we'll see you next time. Thank you for joining me on this episode of UPLEVEL, Real Health, Real Talk. I hope today's conversation inspired you to take the next step in your health journey, one that nourishes not just your body, but your mind and spirit as well. Don't forget to subscribe so you never miss an episode. And if you found value in today's episode, please leave a review. Until next time, keep learning, keep growing, and keep thriving. And remember, true wellness is a journey, and you are on the right path.